Hello, I'm Lori Steiner, sitting in for Armin Budish. Welcome to Golden Opportunities.
Today, the Big C will go to the front lines for the fight against cancer. Heard hearing aid horror stories? We'll separate fact from fiction. Then we'll accessorize your latest look with a smart smile. And we'll reveal when you don't have to pay old credit card debt.
It's time to get GOing, so pull up a chair and join us at our kitchen table for Golden Opportunities. There are several types of skin cancer, but melanoma is the most deadly. And surprisingly, here in Cloudy, Ohio, we rate number 6 in the nation for the most cases of melanoma per year. Surgical oncologist Dr. Bruce Averbook from Metro Health is here to tell us what puts us at risk for developing melanoma and how early detection and treatment could save your life. Welcome to the show on this important topic.
Thank you, Laurie.
Now, we've heard that exposure in youth really puts you at a much higher risk for skin cancer. So later in life, is it just too late to prevent that?
Well, prevention is important your entire life. We certainly know that the risk increases significantly if you have at least one bad burn before the age of 25. But there's also data out now that hits with burns and sun exposure when you're older does carry an increased risk.
So you still need to try to prevent that.
Absolutely.
Even as you get older.
Absolutely.
Okay. Besides sun exposure, are there other risk factors that you can point out with regard to this melanoma?
Well, we look. Patients who are fair skin, fair eyes, blue eyes, easy to burn, hard to tan. These people have an increased risk, and need to be screened.
Okay. How about does nationality or racial background make a difference?
Well, we know some of the Eastern European races, Caucasian, in general, have a higher risk. But I want to say that African Americans should also screen themselves and get screened. They should look at the palms of the hands, soles of the feet, under the nails. Bob Marley died of malignant melanoma.
Oh, I didn't know that.
And it's it was not diagnosed in time.
Ugh, so that's not a good thing. Now, what if you're checking yourself or you find an area of concern? Maybe a dermatologist has identified something. If it's determined to be melanoma, what are your chances of survival?
Caught early, it's really quite good. It's a scary disease. We know it can metastasize to distant organs anywhere in the body, but if it's caught early, if it's under a millimeter, you can also find non-invasive melanomas. These can be taken care of surgically, and that surgery is the primary treatment for melanoma, the initial treatment. So if you have a melanoma that's under a millimeter, a wide excision with all the fat below it, basically good chance of cure. When you hit melanomas that are thicker and over 4 millimeters, have a significant risk of having distant disease develop at some time.
How big is 4 milliliters?
Well, it's about the size, maybe it's the thickness of maybe a $50 or a little over $50.
So not very big.
No, and we're talking tiny areas, but it's with significant risk.
Ooh, so the bigger it is, the longer it maybe had time to grow, and the more likely the fatality is.
Right, the thicker it is, the greater the risk.
Okay, how about when you're removing, you said you remove down into the fat tissues, anything else you worry about in the surrounding tissues?
Well, if you have a melanoma that's over a millimeter in thickness, typically we try to get 2-centimeter margins around it, and then we take all the fat down to the tissues below, all the fat. And then also we'll look at patients' lymph nodes in a very special way, something called lymphatic mapping. It's called sentinel node biopsy and lymphatic mapping, and you can identify the very first lymph node that the tumor may have gone to, remove that, and have it looked at very carefully by pathologists to see if it's spread, and that changes the treatment.
Okay. Any new treatments or new developments or drugs on the horizon?
There's been some really interesting things. We at Metro Health, we have a protocol through me, I'm the principal investigator for Case Western Reserve for the Eastern Cooperative Oncology Group with a drug called ipilimumab. That's a mouthful. Yeah. But it jacks up the immune system, and we're using it for patients right now who have an advanced melanoma that we can actually remove, and then it's what we call adjuvant. It's additional treatment. But it's also available for metastatic disease. And that drug currently in this study I'm talking about is being compared to a drug we also use called interferon.
Okay, so hope on the horizon, we hope.
Yeah, I'm also doing a study trying to limit some of the problems when we take out lymph nodes in a larger scale, which we have to do when the melanomas have spread to the nodes, called lymph node dissections. I'm trying to do a minimally invasive protocol where we're doing this with little scopes and the like, and it's a part of a research trial through the Mayo Clinic.
Oh, keep up the good work.
All right.
All right. Each year in Ohio, over 3,000 people are diagnosed with melanoma. But remember, early detection and treatment can be life-saving. Follow Dr. Averbook's advice. Protect yourself from the sun, visit your dermatologist, and if you have any concerns at all, and for more information, call Dr. Averbook's office at 216-778-4795 or visit metrohealth.org/cancer.
Next, can you believe what you hear? But first, tomorrow we'll celebrate Labor Day with rest and relaxation. But in 1883, when the holiday was first heralded, it highlighted the lack of leisure for laborers, which then led to the fight for employee rights. Can you name the president who authorized this annual observance? Here's a hint. He worked against organized industry employees. We'll parade the answer when we return.
Sometimes it's about beating the clock. Sometimes it's about beating fate. And sometimes it's about beating the unimaginable. But there's one opponent our team loves to beat more than any other. We love beating the odds. We are the Metro Health System. We are the proud sponsor of the comeback.
Though he was anti-organized labor, President Grover Cleveland was put under pressure to sign the Labor Day holiday bill in 1894. By doing his job, we enjoy a respite from ours every first Monday in September. So enjoy your Labor Day weekend.
You've heard them all. There really is a miracle cure for hearing loss. One hearing aid is as good as two, and ordering online is the best way to buy them. Well, listen up. Dr. Burt Brown is here to tell you why you shouldn't believe everything you hear. Dr. Brown is an ear, nose, and throat doctor and the owner of Physician Hearing Centers. Welcome back to the show.
Thanks for having me.
Well, we've got a number of different hearing myths that we're going to show that they are actually mistakes. So we'll start with the first one. Using a hearing aid will restore your hearing to normal. That's not true?
No, it isn't true. I mean, if you think about it, the human body's amazing. The way we see, the way we hear. There's no way that an instrumentation or something we come up with is going to duplicate that. So when you use a hearing aid, it's going to help you hear sounds you couldn't hear before, and it's going to help improve your quality of life, but it's not going to be normal hearing. So it takes some adjustment and things like that. And that's why, as we have been talking about this all along, there's a lot to getting the hearing aid right for you.
Okay. Myth number 2. It's better to purchase hearing aids online or by mail order.
Oh, this is a really sensitive issue in the hearing aid business because, as we've talked about many times, everyone is different with hearing aids. We talked about digital hearing aids, how you can adjust in the computer. Well, you can take two people, identical hearing loss, same hearing aid, put it on the computer, adjust it. You put it in and one will hate it and one won't.
Oh.
There's a lot of fine-tuning. You need someone to learn who the person is, what they need, and they're going to pick out the right aid. A computer's not able to do that.
Okay. Myth number 3. All hearing aids are the same.
Well, there we go, another myth. All hearing aids have like a speaker and a microphone and an amplifier, but then there's far beyond that. I mean, they have different computer chips. There's hearing aids that are made to hear in quiet environments. There's hearing aids that are adjusted for noisy environments. Some have 2 microphones. To say they're all the same is really kind of a way for people who are really trying to push one particular aid. They're not all the same at all.
Okay, and I suppose people use them differently, so they shouldn't be all the same.
Absolutely. I mean, hearing aids even have wireless technology now. They can go into your TV set or come from there, so it's pretty amazing how they're used, and you need to know what the patient needs.
Okay. Myth number 4, 2 hearing aids are not necessary. Now, I would think that would have been true because maybe you have hearing loss in one ear but not the other. Why would you need 2 hearing aids?
Well, I will say if you have a normal ear, you don't need a hearing aid in that ear, and that is an instant where 1 hearing aid is appropriate. Back in the old days when hearing aids weren't that good, they didn't help that much, and they were still costly. So sometimes they put 1 aid in because they didn't work that well. But nowadays with the hearing aids, which can be, when they're done properly, they're so good. If you have 2 ears with hearing loss, you want to do both aids. The body's made to hear out of both ears. We have 2 ears. If it were best to have 1 ear, it would be in the middle of our head, and it's not, and it would look funny. And so when you use the 2 aids and it processes in the brain, that's how we hear the best. And again, we're trying to duplicate that normal hearing process. If you actually just put a hearing aid in one bad ear and the other ear doesn't have a hearing aid that also has hearing problems, in some ways they compete. So it's actually one of the reasons that a person with a hearing aid says, it doesn't really help me, it's more annoying.
Oh, all right. Okay, another myth, the last one for today. I want invisible hearing aids because they're the best.
Well, there you go. So everyone talks about, I don't want to be seen with my hearing aids in, and it's still quite prevalent. But when they're talking about invisible hearing aids, they're talking about the very small ones that fit all the way inside the ear. And the technology has improved significantly. You have hearing aids now that fit all the way, almost all the way up to the eardrum. Okay. You have to put it in a special way. But there's only a certain person that likes that. The technology can be limited in various ways, and it's not real comfortable. The newer hearing aids, and we recommend behind the ear hearing aids most of the time, I would say are almost invisible just because of them. Because I actually have hearing aids in right now, and I bet you didn't even know it.
I had no idea. You're right.
There you go. So if you look carefully, invisible hearing aid, if it's adjusted properly and it's fit properly, that's not a problem anymore.
All right. Wow, great tips. Ear, nose, and throat Dr. Burt Brown can now add Mythbuster to his titles. To get your own free copy of Dr. Brown's hearing aid myths, just call 1-888-461-4041. And for more facts on hearing aids and which one is best for you, use the information that's coming up next.
To learn more, call the Physician Hearing Centers at 440-461-0150 or visit their website, www.physicianhearingcenters.com. Next, start the fall season with a smile. Looking for places to go, things to do? Welcome to our community calendar. Say so long to summer with a party at Playhouse Square. Friday, September 7th from 5 to 10 p.m., the district's block party busts out food, entertainment, a tour around the neighborhood, and a championship cornhole game. To participate, purchase your ticket by traveling to www.playhousesquare.org or telephone 216-241-6000.
When Labor Day arrives, can fall be far behind? Sadly, that means it's time to pack away the pool toys and pull out the autumn attire. But if your fashions for fall are missing that ultimate accessory, let our designer dentist, Steve Marsh, fill you in on how to make the most of this time of year.
Thank you.
Welcome
What a
back again.
Wonderful introduction. Thanks, Lori.
And we would like seeing the leaves turn color, you know, in the fall and all that, but we don't want our teeth to turn color. Is there anything we can do?
Yeah, and one of the things that I like about patients who come in at this time of year is, remember September, some people have dental insurance, and they may have 3 more months to use it, and they always feel badly if they haven't used it. So that's one of the things that I think is that makes this a special time to do it. And you may just have more time in your schedule right about now as we move into fall. But addressing your question about whitening, one of the things that happens as we age, as we mature, is sometimes we brush hard and the next layer comes through. Sometimes there's stain. And so today, a lot of patients come in, they want it done quickly for a wedding, maybe a reunion, and in an hour and a half with the help of Zoom whitening, we can actually whiten their teeth.
That's not long at all.
Here's a patient actually having the whitening done. And I want to caution the viewers, it doesn't get real white, but it makes them much brighter. And everybody gets lighter to a certain degree. And then after after this patient was done with this hour and a half, and by the way, we have television sets, they're able to watch TV while they're having it done. But you need to maintain it with whitening trays. It doesn't always work with every patient. And this is a woman, and she was a Golden Opportunity viewer, and no matter how hard she brushed, she couldn't get them whiter, and that's because she had actually taken away the enamel, Lori. And if you look, the teeth actually have a grayness, a translucency.
That's true, yes.
And no matter how much whitening we would use, it really wouldn't respond. Again, she's missing most of the enamel, and again, the harder she brushed, the worse it got. We use porcelain veneers there. Now, porcelain veneers can be made very thin. You talked about hearing aids can be made very small. Well, today, when we do porcelain veneers, we can make them so thin, 3/10, 5/10 of a millimeter, so they're almost imperceptible and gives a beautiful natural smile and also change the color.
All right, that's what everybody wants, natural and beautiful.
Absolutely.
Any other pointers? And we're going into this new season, so we can have a nice big smile.
Absolutely, and we thought we would show some more pictures of patients that we've had the opportunity to work on and show different techniques, because a lot of things have changed over the years. This is a patient, and your viewers who watch all the time may remember her. She came on with me, and she had been a teacher and worked in the healthcare field as well. Not only were her teeth darker, but they had separated a lot. So we used a combination of porcelain veneers and crowns to give her that beautiful smile. She's always wanted a bright smile. She was always conscious of the spaces, and food would also collect. So that's a beautiful example of a combination of veneers and crowns. And another woman who's a teacher, talk about going back to school. Over the years, she had worn her teeth down, they had broken, the color had changed, and we gave her this beautiful bright smile. She said it was life-changing for her. Again, 10 porcelain veneers, some gum contouring gave her that beautiful smile.
And how about the kids on their way back to school?
You know, it's a great question. I'm glad you addressed that. You know, one of the things we do as kids go back to school is they always play sports, many of them anyway. And in fact, this week we had a kid who just actually swam into the side of a pool and fractured his front tooth. So one of the things that we like to make are custom trays, and they fit so well. It's very similar to a whitening tray. You see a lot of athletes, pro basketball players wearing them, and this is very essential. So if your kids or grandkids are going back to school and they're playing school sports, we really advise a custom-made mouth guard.
Excellent. Good point there.
Thank you.
So as we pack up our warm weather wear and unpack our fall fashions, we might find a few things have gone out of style. But no matter what the season, a beautiful smile is a timeless trend. To make sure your teeth are dressed for success, give Steve a call. His number's next.
See what Dr. Stephen Marsh can do for your smile by calling 440-461-1003 or visit www.clevelandsmiles.com. It's time to get up and go. An exercise minute on Golden Opportunities.
Hello everybody, I'm Mike Carbon from Breakout Fitness, and today we are going to work our rear delts and our trap muscles by doing a reverse fly utilizing our exercise ball. This is a great exercise that will help us keep a nice strong upper body. We're going to start by laying our torso on the exercise ball. We're going to have our dumbbells out in front of us with our arms slightly bent. We want a good amount of distance between our elbows on this one. We're simply going to open, keeping that bend, squeezing the shoulder blades together, and bring them back to the starting position. Okay, so all the way open, squeeze, and close. Remember, you want to take deep breaths with each exercise. 12 to 15 repetitions is a great place to start. How you feeling? I'm on the ball. All right, you're doing great. Squeeze your abs to engage your core, and now it's your turn to get up and go.
For your copy of the exercise booklet, please send $1 for postage to Golden Opportunities, 23240 Chagrin Boulevard, Suite 450, Beechwood, Ohio, 44122.
There's Da Vinci the artist and the Da Vinci Code, but we've artfully solved the case of the newest Da Vinci, a technological tool to help those with low vision. Lee Jarocki from Magnifiers and More is here to paint the picture of how it works. Welcome, welcome.
Thanks to be back. It's always good to be here. Unfortunately, eye diseases in the United States are running rampant. There's over 8 million people right now suffering with what we call low vision. And as our population ages, that's only going to grow in number. Magnifiers and More works with people suffering from low vision. And in the past, I've brought CCTVs here, handheld video magnifiers, and even a unit that has text-to-speech that reads back to you.
Okay, so we've had all these other things on the show, so
Yes.
now we have a Da Vinci. What makes this different?
Oh, this is one of a kind. This is an answer to a lot of people's prayers. Technically speaking, this is a CCTV that has what's called text-to-speech. In plain English, what it does is it will project onto the screen anything that's below it with a plus, and we're going to show that at the end.
It looks just like kind of like a home computer screen. So.
It does. It does. It's a great design. On the arm above the screen is a very powerful camera. So whatever we put below it, in this case I have my business card, anything we put below it is projected up onto the screen. And this, watch this, Lori, this can magnify up to 77 times.
My goodness. People in southern Ohio can probably read that.
They can.
Right through the TV
amazing.
screen.
Yes. Good. It does a few other things as well. Let's say you want to use it for something other than reading. We can use it to write a check. And so we can write underneath here. I filled this out earlier. You can use it, I have doctors that use it to paint with. It can be used in the classroom. Anything that needs to be projected onto the screen, we can do it with a Da Vinci.
That is truly amazing. So you talked, it can be almost anything. So hobbies and people who do close work maybe?
Anything that you need to do with your hands. And I caution you, nobody's fingernails look good at 77x. Anything that needs to be done under the, to be put on the screen can be done under the camera here. So that does include hobbies.
So like embroidery or cross stitch or anything?
Yeah, let's say you want to look at your pill bottles.
Oh, yeah.
I have a fellow that ties fishing flies with it, so he does that. Another fellow that points the camera at his face and he uses this as a mirror, so he shaves with it because he could not see himself in the mirror. Ditto with ladies who want to put on their makeup.
Oh my goodness. So you don't have to have those magnifier glasses. One flips up and the other one flips up. I've seen those. Of course, I don't ever need anything like that.
I don't even know that I'm surprised you even know about it.
And one of the big things about the Da Vinci, I think you said, not only does it magnify and make the, so much easier to read, but it can talk to you. Is that true?
It does. I'm going to make two adjustments. I'm going to turn up the volume.
Volume 8.
I'm going to take a picture and watch what this does.
Hello, Lori. I am Da Vinci. I want to be your eyes to help you do the things you miss most. I especially like to read, and you can see me at Magnifiers and More in Mentor, or I'll come to your place for a free demonstration. Call me at Magnifiers and More. 440-946-3363. Golden Opportunities is my favorite TV show. Love, Da Vinci.
Ta-da! Here we are.
Well, thank goodness it's the favorite show of Da Vinci.
Amen.
This has been great information here for us today. So if you have low vision issues, the Da Vinci might be just the answer for you. To find out more, there's no code to break. You just call Magnifiers and More at 440-946-3363 or visit magnifiersandmore.net. My thanks to Lee for bringing this new technology into focus for us here today.
Always great to be here. Thank you, Lori.
Thank you.
Next, avoid falling into the credit card debt trap.
Hi, I'm Trapper Jack at Nelson Vein Clinic, where varicose veins just fade away. Barbara is here. How long ago since the procedure?
3 weeks.
What did you notice right away after Nelson Vein?
It's all gone.
Pressure was gone?
Oh, it was all, yes.
Pain's gone?
Yes.
And it's covered by insurance.
That is one thing that got me here. That was a big relief. She's very good at what she does. She's terrific. You can hug her like I did.
Isn't it time you took care of your varicose veins? Call or log on to nelsonvein.com.
Did you miss a phone number or website? Then here's your second chance, because we're going to list all of that information again. Then we'll be back to tell you if you should pay old credit card debt. Out of the blue, a collection agency calls to demand payment on an old credit card debt from years ago. This is happening more and more, especially to seniors. At this point, you may not even remember it. Should you pay it? Here with the answers is my law partner who never gets enough credit, Mike Solomon.
Hi, Lori.
Hi. So why are we suddenly hearing about these debt collection companies that are coming after old credit card bills?
Well, some of them just may be scams trying to get free money, but the others, sometimes what happens is credit card companies sell their old debt at a big discount to debt collectors, and that can cause a lot of those phone calls also.
So if we get a call, what do we do?
Well, the first thing to see if it's a scam, just ask them, for a copy of the bill. Likely, if it's a scam, that's the last time you're going to hear from them.
Mm-hmm.
Otherwise, the other advantage is to find out when that debt was incurred.
Okay, well, why is the date so important?
Well, it's important because under the Ohio law, credit card debts, there's a 6-year statute of limitations typically. So if the debt is longer than 6 years ago, you have no legal obligation to pay it. Now, many people feel a moral obligation to pay it, but when it's more than 6 years ago, you may not even remember the debt. And even if you remember the debt, you may not be able to find any old checks, so you're not going to be able to satisfy yourself.
You can't prove it either way.
That's right.
So
that's right.
They shouldn't be able to come after it at that point. Are there ways that debt collectors can get around that 6-year window?
Yeah, there's a little bit of a sneaky way. What happens is many debt collectors have joined with the credit card companies, and they'll offer you a new credit card. But inside that paperwork, it's that you're saying to them, I'm going to agree to revive that old debt. I'm going to pay that old debt. They throw it on your new credit card. Now all of a sudden you owe all this old credit card debt again. The 6 years is blown. They're able to collect it all.
So read the fine print?
That's right. Always, anything that's free.
That's probably true for everything, right?
That's right. That's right.
Read the fine print. And don't pay the bill if it's more than 6 years old. Great advice. If a bill collector is trying to collect an old credit card bill, be wary and don't just pay it to get the bill collector off your back. Collect your facts and demand verification of the debt. If you tell the bill collector in writing to stop harassing you, then they must stop calling or they're violating the law.
Call Budish, Solomon, Steiner, and Peck at 1-888-236-5173 for more information or to schedule a speaker for your organization. Or log on to www.budishandsolomon.com.
Thanks for joining us. Beginning next week, look for golden opportunities at 12:30 p.m. instead of 11:30 a.m. We'll be with you right after the noon news to translate retirement community terminology. Find out the difference between independent living, assisted living, and a CCRC. We'll find out what that means. Then trust us. Trust in us to tell you who really needs a trust. Plus, we'll canvass the Museum of Art to uncover picture-perfect paintings. Until then, please remember to make the most of your golden opportunities.
Would you like to join our kitchen conversation? All you have to do is call toll-free 1-877-765-1543 and leave us your question, name, and phone number. Or log on to www.golden.tv for all the latest information and show updates.